How are you, Fergus? Welcome and have a seat.
I am good, thank you. Feeling a bit anxious, honestly. I'm worried about the gallbladder surgery.
Relax. We'll make sure you have a great experience. You're in good hands. Laparoscopic cholecystectomy is a procedure that uses tiny cuts and a camera to safely remove the gallbladder.
This sounds great. I will have only tiny scars after the operation. This is amazing. What is the function of the gallbladder?
Liver produces bile that passes through a tube or a duct called bile duct into the bowel to help its digestion. Gallbladder is a pear-shaped balloon which stores bile. When food enters the bowel, gallbladder gets a stimulus and contracts to push the bile into the bowel for digestion.
Ada, what if I do not go for the operation?
Not a problem, Fergus. This is completely your decision. The stones which do not produce symptoms generally do not require surgical treatment.
But I had symptoms on few occasions in the past 1 year.
Yes, Fergus. The patients can present with significant pain and discomfort in the right upper abdomen, nausea and or vomiting, bloating and indigestion, especially after taking meals.
That is true. My symptoms match your description. What other problems can I have in the future if I decide to wait?
Good question. The gallbladder can get inflamed, called acute cholecystitis, which is quite a painful condition. Stone may pass into the bile duct, which has the potential to cause jaundice and inflammation of the pancreas, also called acute pancreatitis. This could lead to potential life-threatening problems. Gallbladder cancer is also linked to stones in the gallbladder, especially in patients who have had repeated attacks of inflammation. The gallbladder can lose its blood supply, leading to gangrene and a hole or perforation, leading to leak of bile or pus in the belly, which requires emergency operation and, again, could lead to potentially life-threatening problems.
Oh gosh, this all sounds very serious. I'd better get this out of the way. Ada, how are gallstones formed?
The liver produces bile, which helps in the digestion of fatty foods. Bile contains cholesterol and bile pigments. Hence, either the most common cholesterol stones or less common pigment stones are formed. Excess of cholesterol, especially in people who are dehydrated, can cause its precipitation, converting it into crystals, eventually forming stones. For example, when you add salt to warm water, it dissolves. However, if you add too much, the excess salt will form crystals at the bottom. This happens if the salt content is high or the water volume is low. Additionally, poor gallbladder emptying or a lazy gallbladder can contribute to stone formation like fasting, pregnancy, and rapid weight loss. Bile that stagnates can lead to infections and stone formation, while flowing bile prevents these issues. Gallstones are more likely in women who are fair-skinned, overweight, and of childbearing age.
I am not a female, but unfortunately I had it. I can at least warn ladies in my family. Thanks, Ada, for explaining this to me. Can you please explain the operation in a bit more detail, please?
In this operation, we make 4 small holes in the belly. Some surgeons may make 3 or 5 holes also in certain situations. These hole sizes range from 5 millimeters to 10 millimeters. Then, gas is insufflated to create working space to perform gallbladder operations safely. We introduce stiff tubes which allow the introduction of fine instruments to perform surgery safely. These stiff tubes, called ports, allow control of gas in one direction. When the abdomen is inflated with gas and metallic tubes called ports, and fine instruments are inside the abdomen, then the actual part of the operation starts. The gallbladder is then lifted to expose the most important area, called the Calott's triangle. Calott's triangle is an area where the gallbladder is connected to the bile duct through a structure called the cystic duct, and also contains an artery which supplies blood to the gallbladder. Both these structures need to be disconnected to take the gallbladder away. The artery which supplies blood to the gallbladder is usually identified first and clipped with tiny titanium clips called Liga clips. This is followed by the identification of a small tube called a cystic duct, which connects the gallbladder to the bile duct. This duct is clipped with Liga clips and divided, disconnecting it completely. Liga clips are the most commonly used clips for gallbladder surgery. The gallbladder is then peeled off the liver and delivered in a bag. The operation becomes very challenging in patients who had previous open surgery above the belly button due to the presence of scarring inside the belly. The chances of conversion to open surgery are high in these patients.
What happens after the gallbladder is removed?
You can imagine when we lose our gallbladder, food goes directly into the stomach, causing inflammation of the stomach called gastritis or occasionally diarrhea, as there is no food to mix. Body slowly adapts to this new environment. Remember, gallbladder stone symptoms can be similar to other issues like stomach or small bowel inflammation or ulcers. We use a camera test called endoscopy to check for problems before surgery. This is done only for patients likely to have stomach or small bowel issues. Sometimes, if we are not sure of the anatomy, we may put a dye or a contrast into these tubes to identify the anatomy and prevent damage. This is called intraoperative cholangiogram.
What if laparoscopy doesn't work?
Then, you should be mentally prepared that there are 5 to 10% chances of conversion into an open operation, which means a 4 to 5 inch cut under the right rib cage. We do this to keep you safe, especially with scarring, adhesions, or tricky anatomy. I am sure you will agree that it is better to be safe than sorry.
Absolutely. That's why we trust you. Thanks for explaining it to me. Is the surgery safe if I choose to have it?
Yes, Fergus. This procedure is generally safe and most patients go home without issues. However, a few might experience complications. Bleeding and infection risks are present with all surgeries. A very important risk is the damage to bile duct. Instead of clipping the cystic duct, the bile duct is accidentally clipped or cut. The risk ranges from 1 in 200 to 1 in 500. If this unfortunately happens, then some of these patients may require major operation at a hepatobiliary center. Although bile duct injury operations are successful in most cases, however, if problems or complications persist, it can affect quality of life.
This one is really serious.
That's true, but we take every possible precaution to keep you safe. One of the other important complications is the risk of leak of bile, either from cystic duct or liver in approximately 1% of patients. This complication may require readmission if detected after discharge from hospital. Patients undergo further scans in the hospital, which may show collection of bile in one area, which can be treated by putting drains under local anesthesia. However, if bile is present all over the belly, then these are drained under general anesthesia, either again through keyhole surgery or sometimes with a big cut in the belly, which is an open operation. Some patients might need a camera down their throat, a procedure called ERCP.
Oh, okay.
Small stones or a wide cystic duct can let stones slip into the bile duct, known as retained stones. These can lead to jaundice, infection in the bile duct called cholangitis, or acute pancreatitis. These stones may stay in the bile duct for a while and declare sometime after the surgery, causing jaundice or pancreatitis. These stones can slip into the bile duct either during operation or any time before that. This is unpredictable. Readmission with endoscopic removal of these retained stones may be necessary. Did you understand this, Fergus?
Ada, I get it. It's a lot to take in. Don't worry, we'll keep going and discuss it at the end.
You're right, Fergus. It's overwhelming. A bowel injury is rare but serious complication. Hernias may develop at incision sites. Surgery is the solution to fix them. Patients may develop gastritis in about 10% of patients. As bile is now flowing freely into the stomach, occasionally they can develop diarrhea. These problems can be treated with tablets. The body gradually adapts to the new environment. Blood clots, called deep vein thrombosis or pulmonary embolism, can develop. We take steps to prevent these clots with proper care during and after surgery.
I'm sure you will try your best, but certain things are beyond our control.
That is true, Fergus. There are situations during the surgery when we think it is not safe to proceed either due to difficult anatomy or dense adhesions, and removal of the gallbladder in total may pose significant risk to important structures such as the bile duct and major blood vessels. In these specific situations, we stay away from leaving a part of the gallbladder behind and try to remove all the stones if possible and stitch the remainder of the gallbladder and put a drain in. This is called partial or subtotal cholecystectomy. Rarely, either due to medical reasons or bad scarring or adhesions, when it is not safe to proceed, we abandon the procedure. This is because your safety is supreme and we strictly adhere to the policy of doing no harm.
Ada, this is really frightening.
It's a lot to absorb in one go, so I'm here to clarify anything you don't understand. I can reassure you that the majority of our patients go home without any problems the same evening. Be ready to stay in the hospital overnight or for a few days if needed for medical reasons. Occasionally, we use a drain during the procedure. It might be checked for blood or bile leaks. These drains are usually taken out the next day, but if there's a bile leak, it may stay until the leak stops completely. Being informed about the risks empowers you to make a well-considered decision. By understanding the potential risks and complications, you can weigh the benefits against the risks and choose the best path for your health. Having discussed in detail about the pros and cons of both options, surgery versus watch and wait, it is completely your choice to pick any of these options. Since this is a lot of information, feel free to take more time to think. I can give you another appointment to discuss it further and enable you to make an informed decision and give you an opportunity to ask further questions.
I appreciate it. This helped a lot. If I decide on the operation today, what's the next step? Will there be more appointments or do I go straight to surgery?
You need to have updated blood tests, including liver function tests. I will arrange these tests today. Additionally, you will get an appointment with the preoperative assessment team, who will ensure your fitness for surgery. They will guide you about your medicines. You may need to stop certain ones, like blood thinners, before surgery. Some important medicines should still be taken around the time of the operation. Additionally, depending on your health condition, you may get additional appointments for heart scans, lung function tests, etc., with or without appointments with other clinicians depending on your other health problems. This is very important to ensure your fitness for operation. Some patients need optimization before surgery so that they are in the best health to be able to undergo safe surgery with a successful outcome.
Thank you. I completely understand all of this and will wait for further appointments.
You will receive instructions by mail or phone. Arrive for surgery on an empty stomach in the morning. If someone can care for you, you'll likely go home the same day. Once you're awake and back in the ward after your laparoscopic surgery, you can eat and drink. We advise our patients to stand up and move around as soon as it is safe. It is not very uncommon to feel pain in the belly, nausea, vomiting, pain in the shoulders due to residual gas in the belly. We will provide you with medicines for pain and nausea. Shoulder pain is likely to go away in next few days. Your time away from work will vary based on your job. It typically spans from 2 to 6 weeks, with most people taking around 4 weeks. You can resume essential activities the same evening. However, take it easy and gradually return to normal household tasks over the next week or two, depending on how you feel. There is no strict timeline.
What about driving?
Avoid driving for at least 2 weeks, ideally 4 to stay safe. If your job involves heavy lifting, stick to light work for at least 3 months. Before your gallbladder is removed, stick to a low-fat diet. After surgery, you can eat normally. This procedure is usually simple and doesn't need further follow-up unless your surgeon or anesthetist advises it. If you experience worsening pain, unusual belly swelling, excessive nausea or vomiting, dizziness, fever, palpitations, or any other odd symptoms, go to the hospital's emergency department. If you have more questions, please do not hesitate to contact us or in an urgent situation. Please follow your local emergency procedures. UK residents should dial 999 for ambulance services during emergencies.
I appreciate your help, Doctor. This information was very helpful.
Support us by liking this video and subscribing to our channel. Your encouragement helps us make more videos. We value your feedback.